Snoring may be a joke at dinner conversations, but for millions of people, it's the sound of something much more serious happening inside your body. Interrupted sleep, daytime fatigue, morning headaches, and even heart problems, all rooted in a condition called obstructive sleep apnea or OSA. Hi, I'm Dr. Vikram Singh, oral and maxillofacial surgeon, and today I want to talk about something many patients don't realize, that sometimes the solution to sleep apnea lies not in a machine but in the position of your jaw. Let's start with the basics. Obstructive sleep apnea is a condition where your airway repeatedly collapses during sleep, cutting off your breathing for seconds or even a minute at a time. Your body jolts awake to resume breathing, often without you realizing it. This cycle can happen dozens or even hundreds of times a night. The result? Poor sleep, oxygen deprivation, and long-term strain on your brain, heart, and metabolism. For many patients, the first step is a CPAP machine, a continuous positive airway pressure device that keeps the airway open. And for a lot of people, it works, but some can't tolerate it. The mask feels uncomfortable, the noise disrupts their sleep, and they end up quitting the therapy altogether. This is where Maxillomandibular Advancement or MMA comes in. A surgical option that doesn't just manage sleep apnea, it aims to correct the root structural issue behind it. So what exactly is MMA? In simple terms, it's a surgery where we move both the upper jaw, maxilla, and the lower jaw, mandible, forward. This forward movement physically enlarges the space between the tongue and the soft palate, the critical area that collapses during sleep in OSA patients. By repositioning the jaws, we increase the size of the airway and reduce the chance of obstruction. Think of it as a widening a narrow tunnel so air can flow smoothly through it even during deep sleep. Now here's what makes MMA so powerful. It's not a temporary fix, it's a permanent anatomical correction, and multiple clinical studies have shown that MMA has one of the highest success rates among all the surgical treatments for sleep apnea, especially in patients with moderate to severe OSA who are unable to tolerate CPAP. Who qualifies for this surgery? Not every snorer and not every sleep apnea patient. MMA is usually considered for those who have confirmed moderate to severe OSA through a sleep study, jaw or facial structure contributing to airway narrowing, failed or rejected CPAP therapy, less invasive treatments like oral appliances haven't worked. The process begins with a sleep study, followed by imaging like cephalometric analysis or CBCT scan, and a detailed airway assessment. If you are a suitable candidate, the surgery is planned using 3D software to ensure precision. The procedure is done under general anesthesia, and most patients spend a night or two in the hospital before beginning recovery at home. Now, I won't sugarcoat it. MMA is not a minor procedure. There are swelling, dietary restrictions, and a recovery period of a few weeks. But here's what patients tell me after they heal. I've never slept this well in my life, doctor. Because for many, it's not just about breathing. It's about living again, waking up refreshed, focusing on work, feeling their heart rate drop, and finally being free from the fear of stopping breathing at night. And of course, like any surgical procedure, maxillomandibular advancement comes with risks, infection, numbness, or jaw stiffness. But these are rare and manageable when the surgery is performed by a trained maxillofacial team in a structured hospital setting. If you are wondering why doesn't everyone with sleep apnea get this surgery, the answer is simple. It's not always necessary, but for the right patient, it can be life-changing. Snoring isn't always just snoring, it can be your body's cry for oxygen. And obstructive sleep apnea isn't just poor sleep, it's a silent, dangerous condition that impacts every system in your body. If your jaw structure is part of the problem, it can be part of the solution too. If you or someone you love has been struggling with sleep apnea and CPAP hasn't worked, maybe it's time to look beyond the machine and consider if surgical correction of the airway might be the answer. If this video helped you about understanding more about jaw surgery and sleep apnea, share it. And if you have questions, I'm listening. Drop them in the comments and I'll try to answer them in the upcoming video. Because breathing well should be a luxury, it should be your baseline.